Hi guys, Chris here with Super Savvy Travelers, and we are so excited because we are in Bari today in the office of Nick Mehta at Studio Legale Mehta. And he has set up some very interesting topics for interviews, and we're going to go over some of them right now. To start with, we have the really hot topic of medical care in Italy. How is it different from the US? How does it work? What's the best way to go about it? And how can you make sure that you're covered with what you need and want while you're here, so that in case of any emergency, you know exactly what to do. So we are super excited because we have Dr. Andrea Armenio, who is a plastic surgeon who works with the oncology department. He's going to go over all of our burning questions here on the subject of medical care in Italy. So thank you so much for sitting down with us. So can you tell us a little bit about yourself? What is your experience and your background here?
Well, I'm a plastic surgeon, as you said, and I work in the oncology department here in Bari, in an oncological hospital. And I've been training in England for 3 years, and then I came back in Italy, in Bari, in the southeast of Bari, to share my experience with my colleagues and to help patients here in Puglia.
Wow, that's wonderful. So the big question for our American friends is, let's say I come over here, I have my visa, my elective residence visa, and we'll go over what happens in between before you have your elective resident visa. But what happens then? Our demographic, a lot of them are older people, and there is a huge focus on emergency medical care and how the medical system works. Like, what do you do? So I know it's a big subject, but if we can just go ahead and start with the subject of how do you prepare yourself before you come over?
Okay, I think the very important thing is if you have an emergency or not. If you have an emergency, then probably you cannot choose where to go. So how does it work? You basically, if you have a heart attack or any other problem and you need to be hospitalized, you call 118, which is the national security number for ambulance. Okay, the ambulance will come over, will pick you up with or without a doctor on board, and will take you to the closest hospital. Now, the closest hospital is related to the disease you have. For heart attack, they will take you to the cardiology center, the closest one, okay? And then once you get there, you will go through the process, you will be hospitalized. You will have all the exams, blood test, electrocardiogram, or any other exam you need to go through, and then you may or you may not have an operation. Now, when you stay in the hospital, at the end, when you've been discharged, the hospital will send you the bill for all the treatment. The treatment is not a list of the single health services you have been provided, but it's a fixed cost, okay? So for example, for heart attack, let's say, hopefully none of them will have one, but in case, the total cost is 5,600.
Wow.
And it does cover up to 61 days.
Wow.
So if you stay in the hospital up to 61 days, it's all covered by this fee.
And that includes all of the things like heart attack is one sort of category, and then that's the fixed cost. Does that cover the electrocardiogram, the blood work, everything?
Yes.
Okay, wow.
How does it work in Italy? We match the diagnosis and the treatment you get. Matching those two information, you get a number. Each number is called Diagnosis Related Group, DRG.
Okay.
Related to this number, there is a fee. So it depends on what kind of diagnosis you have and the treatment you get, you will pay a fee.
Wow.
Okay?
Wow, okay.
If you stay more than 51 days, it will never happen, of course, but then you will pay 256 euro for each day after that.
Okay, okay. Wow, that is amazing, because I can't even calculate in my head how much that would be in America if you didn't have health insurance. You would probably have to sell your house. Okay, well, that's quite amazing. So let's take, for example, a fracture. Say somebody's out there on the beach and they do something silly and fracture their leg.
Okay. If you have a fracture, you can choose which way to go.
Okay.
You can go through 118 and then go with the ambulance to the hospital. If you have no one with you, for example, there's no one that can handle you to the hospital. Or if you have time and you can decide where to go, you can go even privately. If you want to go in the hospital, you go through the same process we've been talking about.
Yeah.
And then the cost will be about 3,400 about, okay? And it does cover your hospital stay up to 30 days, okay? And it does include X-ray for the ankle fracture, for example, electrocardiogram, blood test, and the operation as well.
Wow.
In case you need to put a plate on your bone, I don't know, a screw or something else, then it will all covered by your fee. And the fixed fee is 3,600.
Wow. And that, to be clear, that's without any sort of medical insurance whatsoever.
Yeah,
right.
exactly.
Oh my gosh, that's amazing. Okay.
If you have, let's say, a fracture of the finger, which is quite easy to handle, you don't need to go necessarily to the hospital. You can go in a private center. You can have an X-ray of the hand. The cost will be about 30 euro, and that's all. And you can pay that.
Wow.
And you can go straight to the private center. You don't need to go to your GP or any other doctor. You just go there. And then you can ask for a private consultation with orthopedic surgeon, just in case you need a cast or something else. Now, the cost of the X-ray is about 30 euro. The cost for a private consultation with an orthopedic surgeon is about 150 euro.
Okay.
And then it's all done. And then you don't need to go through the hospital unless you need an operation. If you need an operation, you can go either to the public hospital, or you can choose your private hospital. It depends on what you prefer. Or if you have a private insurance company that will cover the costs.
Okay, that's very interesting. So then my question becomes, because I've always heard that you probably need medical coverage until your sanitary card kicks in, but it sounds like you don't really, it's not going to break you if you have a heart attack or if you have a break or an accident or something like that. Now, what about things like cancer that requires ongoing treatment? Like you say, you have to have chemotherapy or something like that. How does that get handled as far as payments and insurance and public health and that kind of thing?
Now, the chemotherapy is a continuous treatment, so it's not just one shot, one day treatment. So it's slightly different. And you are probably, you are asked to pay each single dose of chemotherapy. So you can go to the public hospital because most of the chemotherapy agents are not available privately. So they cost really a lot. And then you should go to the hospital to make sure that the delivery of the drug is safe for you and for your friends, for your relatives, okay? So if you need to stay overnight, they will keep you in the hospital. And then in that case, you pay each access in the hospital, but it's not that high. I don't know exactly how much it will cost the chemotherapy, but it's not that high. You may ask to have a sort of temporary card, which is STP, where you can have a sort of temporary access to the hospital, to the public hospital.
Okay.
So you pay part of the costs, but not all of them.
Now, the temporary card, that's before you have any sort of visa or anything? Okay.
Yes.
So do you have to be a resident in order to get that card?
No, not necessarily.
Oh. So for example, somebody comes here, because we have several people that want to come and spend 3 months, go home, wait 3 months, come back 3 months. In a case like that, they can buy a temporary card that will cover them a little bit?
Yes.
Okay, that's interesting.
Well, actually, you don't buy. You ask for it, and it's provided.
Wow.
And there are some patients coming from abroad to have treatment in Italy.
Yeah.
For example, they come from Eastern Europe, where they don't have all the facilities to have the proper treatment for cancer reconstruction, for example, and we do a lot of them, a lot of it. And they have a temporary card to provide them the treatment, and then they go back home.
Wow. Oh, that's amazing. Okay. Okay. So it sounds to me like you don't really need supplemental coverage. Like say, for example, you come over and you become a resident and then you get the health care. And if that's, I was always kind of led to believe that if you bought a supplemental coverage, that would make you get health care faster or better care. How does that work? Is it even worthwhile getting supplemental coverage, or should a person just go private?
I think to go privately it's not that expensive, so it's probably easier. I mean, it depends on the insurance company you have and the type of agreement you have with an insurance company. If they provide just part of the treatment, I don't think you really need it. Yeah. You probably need to go straight privately, and it will shorten the time. You see, the problem with the health system, the national health system, is the time it requires to have a consultation. Mm-hmm. It may take too long, and sometimes you are put on waiting list to have the treatment. Okay. If you go privately, according to the professionist, to the specialist you ask for, of course the time is a lot shorter. Okay. And you can treat your disease very quickly.
Wow, wow. So that brings up things like hip replacement surgeries and things like that. I would imagine there are places in Italy that do a great job on that. So if somebody were to do that, say they came over from the US and then they needed a hip surgery, for example, which is something that, of course, I'm always interested in hearing about. But what would something like that cost?
The hip replacement is not very cheap comparing to the other fees we pay in Italy, because we pay the hospital, the surgeon, and the hip.
The implant.
The implant, exactly.
Okay.
So it's an extra cost, but it's not that high. The cost is about 6,000, 7,000, but that's all.
Oh, that's nothing. That's nothing. So yeah, so by way of comparison, we were talking with Pete about his heart attack last year. He was in ICU for, I think, one day and maybe another day in the hospital. And the bill that he saw that went to the insurance company was $85,000. Okay. So for a heart attack, and we're talking about, what, 5,600 versus 85,000. Yeah. I know where I'm going to have my heart attack next. It makes sense to have it here if you're going to have one. In case of an emergency, the ambulance, is it better to just drive somebody to the hospital or wait for the ambulance to come? Do ambulances charge extra?
No. No, the ambulance cost is all included in the fee the hospital will send you. And it depends. For example, during the COVID period, we have a very long waiting time for the ambulance to come. And that could be a problem. And the other thing is that not all the regions in Italy, they work in the same way. You may experience some longer time in some regions and shorter time in some other regions. It depends on the organization of the hospital. And so it depends on the type of injury you have. For example, if you have a burn injury, then you have to go to the burn unit. And there are only 2 burns units at the moment in Puglia. One is in Bari, the other one is in Brindisi. So you need the ambulance to stabilize the patient and to transfer you as quickly as possible to the closest center. Okay? So it depends. If you have a fracture, it's probably easier if you go by car, if you have a friend. Otherwise, there is no hurry. You just can wait for the ambulance, for the 118 to come and pick you up.
Well, say you have, because we're in a little hill town, and there's a lot of hill towns that are quite remote. In a situation like that, say you're in Verbicaro or someplace that's kind of, a good 40 minutes from, the hospital. What would your suggestion be at that point? We just throw the person in the car and drive really fast?
I would go probably with a car.
Yeah, okay.
Unless the patient is unstable. If you need to take venous access, which means that you need to stabilize the patient, it's better to go with the ambulance, even if you have to wait longer. Because during the transfer, the doctor or the nurse in the ambulance will start to give you some fluids or some treatment which can save you the life. For example, for heart attack, there is the famous golden hour.
Yeah.
Within the first hour, you have more chances to survive. If you waste that time, you probably will not survive. So it's very important to have the proper treatment from a trained person.
Okay, okay. Now, if you're in a remote hill town and the ambulance is going to take a long time, can a local doctor take care of that, stabilize the patient a little bit while...
I don't think he has the facilities.
Okay. Okay, that's good to know.
That's the problem.
Yeah.
Because the GP basically is entitled to treat easy things and to prescribe some drugs.
Okay.
But he has no facilities to stabilize the patient.
Okay, okay.
And he will not take the responsibility to treat the patient at home or in the middle of the street.
Okay, that makes sense. That makes sense. At what point, like say a person comes over here and they're working on getting their residency, at what point can they apply for the universal health care here in Italy?
It's not a medical thing.
Right, it's
more
administrative.
Yeah, exactly.
Yeah, okay. Oh, thank you so much for your time. We really appreciate it.
My pleasure, and thank you.
You're welcome.